Every single morning, without even thinking about it, you are doing something in the first 25 to 30 seconds after you open your eyes that is quietly, invisibly, and dangerously stressing your heart. Not your diet, not your exercise routine, not your cholesterol. The very first movement you make when you wake up, that one automatic, thoughtless habit you have done every single morning of your adult life, and nobody has ever told you it could be killing you. Doctors don't mention it at checkups. It's not on any health pamphlet. And the terrifying part, it takes less than 30 seconds. But those 30 seconds repeated every single morning for years could be the most dangerous 30 seconds of your entire day. Stay with me, because what I'm about to show you in this video might be the most important thing you watch all year. And it starts the moment your alarm goes off tomorrow morning. My name is Dr. Victor Hale. I am a board-certified cardiologist with over 22 years of clinical experience. I have treated thousands of patients, men and women, who came to me after their first heart attack, their second, their third, and in nearly every single case, when I asked them to walk me through their morning routine, I found the same pattern, the same mistake, repeated every morning, for decades. These were not unhealthy people. Many of them exercised, many of them watched their diet, some of them were on medications, and yet their hearts were under enormous, unnecessary stress every single morning before they even got out of bed because of something that takes 25 to 30 seconds and feels completely harmless. Today, I am going to tell you exactly what that mistake is, why it is so dangerous, what it does to your heart in real time, and the simple correction that takes the same 25 to 30 seconds but protects your cardiovascular system instead of attacking it. And I want you to ask yourself something right now when you wake up tomorrow morning. What is the very first physical thing you do? Think about it, because I already know the answer, and so does your heart. Let me start with something that most people, including many physicians, do not fully appreciate. The moment you transition from sleep to wakefulness, your body undergoes one of the most dramatic physiological shifts it experiences in a 24-hour period. During deep sleep, your heart rate is slow, your blood pressure is at its lowest point, your blood is slightly thicker due to overnight dehydration, your cortisol is beginning to rise in preparation for waking, and your cardiovascular system is in its most vulnerable state of the entire day. Cardiologists have known for decades that the hours between 6 a.m. and noon account for the highest incidence of heart attacks, strokes, and sudden cardiac events. This is not a coincidence. This is biology. This is the window when your heart is already under the greatest natural stress, and this is the exact window when most people make the mistake I am about to describe. So when I tell you that what you do in the first 25 to 30 seconds after waking could be dangerous, I am not speaking in metaphors. I am speaking about measurable, documented physiological stress on a cardiovascular system that is already at maximum vulnerability. Now, what is the mistake? The mistake is this. You hear your alarm, and you sit up fast, or you roll over hard and reach for your phone, or you throw your legs over the side of the bed and stand up immediately. You go from horizontal, sleeping, completely still, to upright and moving in under 30 seconds. It feels like nothing. It feels like waking up. It is what you have done every single morning since you were a child. But here is what is happening inside your body during those 25 to 30 seconds that you cannot feel and cannot see. The moment you move suddenly from a lying position to sitting or standing, gravity immediately pulls a large volume of blood, approximately 300 to 800 milliliters, nearly 2 full cups of blood, downward into your legs and lower body. Your heart suddenly has less blood returning to it. Your brain suddenly has less blood reaching it. Your blood pressure drops sharply, and your cardiovascular system has a fraction of a second to compensate. It does this by firing your sympathetic nervous system, your fight or flight response, which triggers a sudden surge of adrenaline, causes your heart rate to spike, causes your blood vessels to constrict rapidly, and causes your blood pressure to swing upward in an attempt to restore equilibrium. This entire sequence, the drop, the surge, the spike, the constriction, happens in seconds, and it is called orthostatic stress. Now, here is the critical question I want you to think about. What do you think happens when you subject a heart that is already in its most vulnerable state of the day, with blood that is already thicker from overnight dehydration, with arteries that are already under their natural morning inflammatory peak, to a sudden adrenaline surge and blood pressure spike every single morning for 30, 40, 50 years. What do you think that does over time to the walls of your arteries, to the plaques that may already be sitting in your coronary vessels, to the electrical system of your heart that controls your rhythm? Because I can tell you exactly what it does. I see the results in my clinic every week. Sudden orthostatic stress in the morning is one of the most underappreciated triggers of cardiovascular events. Studies published in major cardiology journals have shown that the rate of heart attacks peaks sharply in the first 2 hours after waking, and the physical act of abrupt positional change is a significant contributing factor. When you sit up or stand up suddenly and that blood pressure spike occurs, it doesn't just stress your heart. If you have any arterial plaque, and most adults over 45 have some degree of plaque, whether they know it or not, that sudden pressure surge can cause what cardiologists call plaque rupture. A small piece of the fatty deposit on the wall of a coronary artery cracks or tears under the sudden mechanical stress, and when it ruptures, the body sends clotting factors to repair it. That clot can partially or completely block blood flow to the heart muscle. That is a heart attack. Not from cholesterol alone, not from years of bad diet alone, from the mechanical stress of standing up too fast on the wrong morning, with the wrong plaque, in the wrong artery, and you felt nothing leading up to it. You just woke up and stood up, the way you always do. Now, before I go further, I want to pause and ask you something directly. How many people do you know, a parent, a friend, a coworker, who had a heart attack out of nowhere, who seemed fine, went to bed healthy, and woke up in crisis? I want you to think about what their morning looked like. I want you to think about what habit they carried into that morning that they had carried every morning of their life. Because in most cases, the event did not come out of nowhere. It came out of a pattern, a daily, repeated, invisible pattern of cardiovascular stress that accumulated over years until the system could no longer absorb it. And the pattern started in the first 30 seconds of the day. Now, I also need you to understand something else that makes this even more dangerous for most people watching this. The morning adrenaline surge from abrupt waking does not just affect your blood pressure, it affects your blood itself. Overnight, while you sleep, you lose approximately 500 milliliters of fluid through respiration and perspiration. You wake up mildly dehydrated every single morning, even if you don't feel thirsty. Dehydration increases blood viscosity. Thicker blood flows more slowly, is more likely to form clots, and puts more mechanical strain on the heart with every single beat. Now add the sudden positional change, the adrenaline spike, the blood pressure surge, and you have a perfect storm of cardiovascular stress happening in 25 to 30 seconds, before you have spoken a single word or eaten a single bite of food. This is what I mean when I say that most people are unknowingly attacking their own hearts every morning, not intentionally, not dramatically, quietly, automatically, in less than half a minute. And now I want to address something that I know many of you are thinking right now.
You're thinking, Dr. Hale, I have been waking up this way for 40 years and I am fine.
And here is what I want you to understand about that. The cardiovascular system is extraordinarily resilient. It absorbs damage for years, sometimes decades before it shows symptoms. The heart attack does not happen on the first morning you stand up too fast. It happens after years of accumulated endothelial damage, arterial wall stress, and repeated plaque microtrauma. The absence of symptoms is not the absence of damage. I have looked at the coronary scans of patients who felt completely healthy, who ran, who exercised, who ate well, and found significant arterial disease that had been building silently for 20 years. The body compensates until it can't, and when it stops compensating, it stops fast. So the fact that you have been doing this for years without a heart attack does not mean the damage is not there. It means your body has been absorbing it. The question is, how much longer can it absorb it? And more importantly, why would you keep making the same mistake when the correction is this simple? Here is what I want you to start doing tomorrow morning. And I want you to notice that this takes the exact same 25 to 30 seconds as the harmful version. It simply uses those seconds differently. When your alarm goes off, do not sit up. Do not reach for your phone. Do not throw your legs over the side of the bed. Instead, stay lying down for the first 10 seconds. Keep your eyes open. Take 2 slow, deep breaths. Let your heart rate begin to rise gently, naturally, without the shock of sudden movement. This gives your sympathetic nervous system time to begin activating gradually rather than explosively. In the next 10 seconds, slowly roll onto your side. Bend your knees. Stay in this position for a few seconds. Let your blood pressure begin adjusting to a partial position change rather than a full orthostatic shift. This side-lying position allows gravity to redistribute blood more gradually than sitting straight up. In the final 10 seconds, use your arms to gently push yourself up to a seated position on the edge of the bed, not by throwing yourself up, but by pressing up slowly. Sit at the edge of the bed for a moment before you stand. Let your feet touch the floor. Let your circulation stabilize. Then and only then stand up slowly. The entire sequence takes 25 to 30 seconds, the same time you were using to lurch upright and reach for your phone. But the difference in cardiovascular stress between these two approaches is significant, measurable, and over months and years, it is the difference between a heart that accumulates damage and a heart that starts each morning protected. This technique is actually taught in cardiac rehabilitation programs. It is what we instruct patients to do after a heart attack or cardiac procedure. The question is, why do we wait until after the damage is done to teach it? Now I want to give you 4 additional morning habits that, combined with the correct waking technique, create what I call a cardiac protective morning protocol, because the first 30 seconds set the tone, but the first 30 minutes determine the trajectory. The first habit is hydration before anything else, before coffee, before food, before your phone. Drink 8 to 12 ounces of water immediately after standing up. This is not optional for cardiovascular health. Remember, you are mildly dehydrated every single morning. Drinking water immediately begins to thin the blood, reduces clotting risk, helps your kidneys begin filtering, and supports blood pressure regulation. Every minute you delay this while your blood remains thick is an unnecessary minute of elevated cardiovascular risk. The second habit is avoiding the phone for the first 10 minutes. I understand this sounds difficult for many people. But here is what your phone does to your cardiovascular system in the first minutes of the day. It activates your stress response. The moment you read a news alert, a work email, a social media notification, your cortisol spikes, your heart rate increases, your blood pressure rises. You are adding a psychological stressor on top of the physiological stress your body is already navigating from the transition out of sleep. Your heart does not need more stress in its most vulnerable window. It needs 10 minutes of calm. Give it that. The third habit is a 5-minute gentle movement sequence before eating or drinking coffee. Not intense exercise, not a run. Simple, slow movement, gentle neck rolls, shoulder circles, ankle rotations, slow walking in place. This activates your circulation gradually, helps your lymphatic system begin moving, and warms up your vascular system for the demands of the day. Think of it as a cardiovascular warm-up, the same way you would warm up before a workout. Your heart is a muscle. It responds better to gradual activation than to sudden demand. The fourth habit is delaying coffee by at least 20 minutes after waking. Caffeine is a vasoconstrictor and a stimulant. Consumed in the first minutes after waking, when cortisol is already at its natural peak, it amplifies the cortisol response, further raises heart rate and blood pressure, and adds chemical stress to a cardiovascular system that is already under its maximum natural daily load. Waiting just 20 minutes allows your cortisol to begin its natural decline, allows your circulation to stabilize, and means that when caffeine enters your system, it is working with your biology rather than against it. This one change alone has measurable effects on morning blood pressure readings. Now I want to speak directly to those of you who are over the age of 55, who have high blood pressure, who have been told you have high cholesterol, who have a family history of heart disease, or who have already had a cardiac event. Everything I have described applies to you with double the urgency. Your cardiovascular system has less reserve, your arteries have less elasticity, your plaque burden is higher. The morning vulnerability window is more dangerous for you than it is for a 30-year-old. The habits I have described are not optional lifestyle suggestions for you, they are clinical recommendations. The correct waking technique: immediate hydration, no phone for 10 minutes, gentle movement before stimulants, delayed coffee. These are not complicated. They do not require any equipment. They do not cost any money. They require only awareness and intention. And the awareness starts right now because now you know what the mistake is, why it is dangerous, and exactly what to do instead. So let me ask you one final question before we close, and I want you to think about this seriously. If someone told you that there was a specific thing you were doing every single morning that was measurably stressing your heart, that took less than 30 seconds, and that had a simple, effortless correction, would you change it? Of course you would, because you are watching this video, because you care about your health, because somewhere in the back of your mind you have felt that things could be better in the morning, that the grogginess, the stiffness, the racing heart when the alarm goes off, the brain fog might not just be normal aging. Some of it isn't. Some of it is the 25-second mistake. And starting tomorrow morning, you don't have to make it anymore. 10 seconds lying still, 10 seconds on your side, 10 seconds sitting at the edge of the bed. Then stand. That is it. That is the correction. That is the gift you give your heart tomorrow morning before you do anything else. Share this video with someone you love who drinks coffee the moment they wake up, who grabs their phone before their eyes are fully open, who throws themselves out of bed every morning like the house is on fire, because their heart is absorbing something they don't even know is happening. And now you have the knowledge to change that. I'm Dr. Victor Hale. Take care of your heart. It has been taking care of you every second of every day, including the ones you spend sleeping. The least we can do is give it a better 30 seconds every morning.